Emergency wards are at capacity, ill staff are still working, and COVID-19 patients with low oxygen levels keep flooding in. This is one of the wards as China is facing a spike of COVID-19 cases. The second largest economy in the world is battling with enormous strain since the recent scrapping of its zero-COVID policy. 3 years of zero-tolerance measures have battered China's economy.
Our daily workload is huge. At this moment, we have reached our emergency capacity of more than 530 patients.
There are signs that mainland China's biggest cities are edging closer to living with COVID-19, with packed subway trains in Beijing and Shanghai. China is the last major country to move towards treating COVID-19 as endemic. The World Health Organization says it's concerned about the situation in Beijing.
WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
Dozens of body bags piled up in some funeral parlors. Chinese Foreign Ministry insists that domestic production of medical supplies is expanding and is generally sufficient.
As the epidemic enters a new phase, we have taken the initiative to optimize our prevention and control measures to ensure they are more scientific, precise and effective. The State Council's Joint Prevention and Control Mechanism has held several briefings to introduce the situation. Currently, China's vaccination rate is rising.
Japanese authorities have announced that they require negative COVID-19 tests upon arrival for travelers from mainland China.
Temporary special measures will be taken for those entering Japan from China. We would like to set up a system as soon as possible and apply these measures from midnight on December 30th.
Chinese authorities say the latest adjustment in COVID-19 response will move from preventing infections to protecting health and preventing severe cases. The Chinese Center for Disease Control and Prevention says it will publish data on COVID-19 once a month when the disease comes under Category B management. Khayelihle Khumalo, SABC News, Johannesburg.